And good morning, everyone. Welcome back to Cheddar's Opening Bell. I'm Baker Machado in New York, and the light is finally at the end of the tunnel, and it's one step closer today. Starting today, some Americans will receive Pfizer's coronavirus vaccine. Millions of doses are being sent all across the country as we speak. So joining us now to discuss is infectious disease expert Dr. Robert Frenck, director of the Vaccine Research Center over at Cincinnati Children's Hospital. Dr. Frenck, great to have you here. Thank you so much for joining us. What are some of the major challenges, obviously, with distributing a vaccine like this? We know that this has to be kept at super ultra cold temperatures. So does that make that a challenge when doing something like this?
Well, it's going to be a little bit, but the thing is that almost all hospitals have at least one -70 freezer. So it is going to be a little bit different than most, but I don't think it's going to be quite as bad as a lot of people have been thinking.
Dr. Frenck, so who is going to be the first to really get the vaccine, and where are most of these doses really going to be going to?
So initially, our demand is going to exceed our supply, so initially we're going to be looking at giving them to frontline healthcare workers and people that are living in long-term care facilities, because these are groups that really have the highest risk. And then as we get more doses, we'll be expanding out.
We saw this poll in Reuters that some states say they'll be able to vaccinate anywhere between about 13 and 18% of their healthcare workers based off of that first distribution. Again, we know that this is just a small batch that's going to be able to get it at first, but does a number like 13 to 18%, does that concern you at all working in the healthcare space?
Well, it's a start. And I think the thing that people need to remember is that using the masks, which I don't have on now because I'm in my room by myself, but masks and hand washing and eye protection can prevent about 85% of the cases. So as a short-term solution, our PPE is really good. We will be having vaccine increasing supply. I really think I'm looking at March or April to where we really have a good supply for everybody.
Okay, that's what I was just about to ask. When do you feel like things might look good for the average, normal, healthy person? They say Q2 might be where we start seeing more doses then. So you think maybe March or April?
That's what I'm thinking, as far as that both Pfizer, who had the EUA approved, and Moderna, who probably is going to have the EUA approved this week, are saying they can make about 1 billion doses each by the end of the calendar year 2021. So with that, that's why I'm saying around March, April, I think that there'll be a ready supply of vaccine.
And Dr. Frenck, a lot of people want to know, how will they know when they're basically able to take the vaccine? I know obviously this is a state issue that particular states will be able to dictate who gets it and who doesn't, but how will people be able to know when they're able to finally be able to take it?
So I can't tell you exactly on it, but my assumption would be is that the state will be rolling out things to say, okay, this is your group now, and that the ACIP, the Advisory Committee on Immunization Practices, put out 3 different phases that they would recommend vaccinating. And so it would be the frontline healthcare workers, the long-term healthcare residents, and then looking at teachers, and then after that, and people with high-risk conditions, and then everybody else. So that I think we'll be seeing, like I said, by the spring, at the latest early summer, have really a good amount of vaccine for everybody. And then the most important thing is reminding people we need to get that vaccine into everybody.
Absolutely. I totally agree with that, Dr. Frenck. Who should not be getting this vaccine? Just based off of the trial data that you've been getting right now, who should basically still wait this out and not take this vaccine?
So this is not a live vaccine. This vaccine will not give you COVID. So that even if you're immunocompromised, there's really no reason not to get this vaccine. So I would really say everybody should be able to get this vaccine. If there's a live virus, sometimes the immunocompromised people, we would have restrictions, but this is not a live virus vaccine.
Okay, and when you mentioned masks, obviously that's still very important. Should you still wear your mask, practice social distancing, wash your hands, all of those things that we've been doing over the course of last year, even after you've gotten the vaccine? How long should you continue to keep doing those practices?
So thank you, Baker. That's a great question. So that right now, the efficacy is based on 7 days after the second vaccine. So from the time that you got vaccinated, it would be about another month. And that really, I would still advocate having people be staying in the masks and that for even maybe a little bit longer than that until we get a good cadre of people people that have been vaccinated. But I think there is a light at the tunnel, being able to get rid of the mask, be able to have vaccination, but it's still going to be a couple more months.
All right. Well, listen, we've made it this far. What's a couple more months, I guess, at this
Exactly.
point? Dr. Robert Frenck, such a pleasure to have you here, sir. Thank you so much for your insight here. He's, of course, Director of Vaccine Research at the Cincinnati Children's Hospital. Thank you again, Dr. Frenck.